Well, hello, everyone, and thank you. Good afternoon. Thank you for making some time to join us today and to participate in this webinar on support for stress management and tips for addressing mental health challenges. So, as everyone knows, we are trying to do our best to navigate unprecedented times. And I speak not only as a member of Congress, but also as a parent. And we are all focused on preventing the spread of the coronavirus and taking individual responsibility to do our part, and also to stay physically healthy, but also taking care of our individual mental health is also really important. So good mental health can help you, and it can help your family better cope with COVID-19 and the uncertainty and the upheaval that it has caused in our lives. So I'm the father of 4 kids. My wife and I, we talk a lot about what we can do for our kids and for each other and for each of us individually to manage a lot that's coming at us in such stressful and unprecedented times. So with our kids, we try to do our best to listen to them, to talk to them about what we're experiencing with the virus and economically and so much more, and also to listen to their questions and to support them and understand the challenge that they're facing. And they may experience it differently and may express their frustration or their stress or their coping in different ways. And we just try to listen to them. So in my case, it hit our family really hard in that I have had the coronavirus. I was tested positive for COVID-19 and spent 8 days in the hospital. So that was very stressful on my wife and our kids, as well as I was struggling to having a tough time breathing and unsure as to when I would come out of the hospital and those daily updates. So we had to support our kids through my 8 days in the hospital when I was treated. And so, it was particularly hard because they couldn't visit me, unlike sicknesses in the past. They couldn't come to visit. And so we did a lot by video chat and tried to stay in touch that way. I also recognize that my family's fortunate. We have resources that we can turn to in stressful situations and when stressful situations arise, and not everybody has that. I think we are all, though, learning how important it is to reach out virtually to loved ones, to people who can support us emotionally and mentally, and to check on people who we support, and to make sure that we stay connected and we support. As human beings, we are naturally a social people, and doing what we can to support each other and to stay connected, even as we've been forced to hunker down and to stay at home in many cases. So fortunately, we're starting to see some of those restrictions ease, and as they ease, we can all find time to get outdoors, to enjoy some fresh air and sunlight, some physical exercise, turn off our screens, and have a little bit more personal interaction as we take it slowly and responsibly, but get out there a little bit. And so that's starting to help, I think, some of us. So I learned when I was the mayor of Salt Lake County that our community, that there is a support network here to help us and to support us, where we can turn to when we need help. So we've got our individual support networks and family and loved ones and friends who we rely on. But there are other resources available too that we want to make sure that people are aware of. We have dedicated behavioral health professionals, and we have an experienced volunteer organizations who have so much to offer. And much of it is at low cost or no cost. In some cases, it's free to people who need it. So as a member of Congress, I learned that even before the COVID-19 public health crisis, Utah was a state with a high risk for death by suicide, particularly for those in the age group of 15 to 24. And that's something that I'm concerned about and that have been working on as a member of Congress. And knowing that we do have a statistically higher average, it's even more critical that we meet the need and that we have crisis teams available to help to save lives for those who really are struggling. So we have crisis teams available. We have them available 24/7, as we do with the National Suicide Prevention Hotline. So let me just pause there and note that if you or someone you know is having thoughts of suicide, and struggling, please seek professional help. And I'm going to give you a number that you can call to do that. It's 1-800-273-8255. That's 1-800-273-8255. There's also a great resource that's primarily for students and youth, but the Safe Utah app, and you can chat with people there. So download the Safe Utah app, or dial that suicide hotline if that is a resource that you need. If you or someone you love and know is in need of professional services, is contemplating suicide, please dial that number. So if you or someone you know is struggling emotionally or having a hard time, you can be the difference in getting them the help that they need. So other mental health groups and counselors have had to adapt to these times, as each of us has. Sounds like my laptop has some noise. Let me just turn that off. So we've had to adapt just as we all have. And rather than offering in-person meetings, most of those meetings have moved online, but resources are available, professional resources are available online if you need them. So we hope that today's online event, this event that we're having right now, can help you navigate these difficult times and provide some additional guidance and resources to support you, everywhere from professional resources to skills or things that you can do to manage just some of the day-to-day stresses that we all are feeling in these unprecedented times. So that's one of the reasons that we decided to offer this online discussion today, to make sure people are aware, first of all, that I think everybody is having challenges, as you would expect, as social beings, being cooped up as long as we have, that presents challenges, and the spectrum of challenges may differ from household to household and individual to individual. And so we just want to make sure that there's tools at your disposal to help each and every one of us, and that you're also aware of some of the professional resources that you can seek out there outside of this web event today. So I am grateful that some experts in the mental health arena have joined me today. And I just want to say, we talk a lot about mental health. I just want to say that and recognize that there's been so much stigma in history, and let's acknowledge that all of us have mental health, just like all of us have physical health. Some of us are healthier from time to time. Sometimes we all have physical illness and physical sickness, and mental health is something that we all have, and we all have different degrees of mental health at different times. And so it is, let's detach the stigma from that and just acknowledge that this is something that we all have, that we all deal with, and that there are resources, informal, peer support, family support, and professional resources, and it is okay to accept and receive, acknowledge that where you're struggling, and to seek help to the degree that it's necessary. So let me introduce briefly who we have, some of the professionals that we have joining us today, and they'll each give us a short presentation with some tips and some recommendations for staying mentally healthy. And after that, we will open it to questions from you. So if you do have a question you want to ask, you can start submitting your questions now with the chat feature to our host or moderator as you listen to the experts. Just go ahead and submit those questions now. We probably won't have time, depending on how many questions are asked, we won't have time to answer all of the questions. And if we don't have time to answer it in this web format, we will get back to you offline after the event's over. So first of all, we have, let me introduce the experts who we have with us. First, Dr. Travis Mickelson is board certified in psychiatry and neurology and is an adjunct professor at the University of Utah School of Medicine. He did a fellowship in child and adolescent psychiatry at the University of Utah, and his interests include developing evidence-based methods for mental health education and integration with primary care settings. So he's going to have some good tips for parents relating to their kids' mental health. Next, we have Taryn Hyatt. She is the Utah Area Director for the American Foundation for Suicide Prevention. Good to see you, Taryn. Their mission is to save lives and to bring hope to those who are affected by suicide through prevention programs and educating the public about risk factors. So they also raise funds for suicide research. Taryn was a great resource for me as I worked to pass my suicide prevention bill in Congress that passed the House, and to help provide more tools. My legislation was help to provide more tools to our mental health professionals so that we can halt the alarming rise in the rate of suicide in Utah and really across this country. And lastly, we have Rob Wesseman, who is the Executive Director of the National Alliance on Mental Illness, or NAMI, N-A-M-I, the Utah chapter. Rob is a person who I worked very closely with over the years when I was mayor, and he knows Utah's mental health community very, very well, a wealth of experience really on the ground working with our mental health community and the providers. And so let me tell you a little bit about NAMI. NAMI's mission is to ensure the dignity and to improve the lives of those who live with mental illness and to support their families. So it's a grassroots organization that's comprised of many dedicated volunteers and individuals who know firsthand how family members struggle with and recover from mental health challenges. NAMI offers free support groups for family members and loved ones of individuals with a mental health condition. So with that, let me turn it over to our experts. And Dr. Mickelson, can we turn it to you to kick things off?
Yes, are you able to hear me okay?
We can hear you great, thank you.
If I had $1 for every time I've heard that said this last month,
right?
I would be a rich man. Well, thank you, Congressman. It was great to listen to you talk about some of the strategies your family is using. And I think you might find that those are on that list of common approaches to managing stress. Also, Rob and Terrence, great to be with you. I really appreciate the work you're doing for our community. So this is a real honor. I'll try to take a few minutes and just give you some of my thoughts, but I'm very interested in listening to the other presenters as well as trying to answer some of the questions from the audience. So, you know, a couple of the adjectives that we hear a lot these days that we've even heard earlier today is unprecedented and novel. And what that does is that brings up a sense of fear of the unknown. And one of the best ways that we can manage fear is by information. And so one of the big tips we have for parents out there who are dealing with their children who are worried about what might happen is to be that source of truth for your children, and really find time throughout the day on a regular basis that you can try to answer their questions and listen to some of the things that they're worried about. But let me just talk a little bit about a couple things that we do know, because although the coronavirus is a bit of an unknown, unprecedented time, there are some things that haven't changed. First off, one of the things that hasn't changed is we all need to have a sense of physiological safety. We all need to feel like we have the ability to find food and get our meals and have a place to live. And so for people who are really struggling with those basic needs, this is an important role that we play as a community to help support them. Because many of the strategies we have of helping children and teenagers managing anxiety and big emotions have an expectation that other things like food and shelter and safety are already being taken care of. The other thing that we know as parents is we know our children very well. And Ben, you mentioned that you're a father of 4 children. I'm a father of a couple of children myself. And each of these kids came into this world with their own temperament, their own personality. And some of them seem to tolerate stress a little bit better than others. And some of them tend to be a little bit more rigid in their routines and seem to be a little bit more reactive when things don't go their way. So one of the things I think is really important for us as parents to realize, again, during this time of a lot of uncertainty, is that we know our children best. And so we're going to know when our children are really struggling. The other thing that we know about children and about teenagers is that the job of a child is to feel that they are good at things. And so one of the tips that we have for parents of children is to help include them into the decision making and into the process of keeping your family and your home safe. Give them activities that they can do and catch them doing things well. This is one of the things that's so beautiful about teachers. And for all the teachers out there, we give you all a virtual high five right now, because we're really missing the love and support you've been bringing our children all year long. But one of the things we love about teachers, what they're so good at, is that they're very good at catching our children doing things well. And so the other thing we know is we know that adolescents' job is to decide, to answer that question, who am I? And for a teenager to answer that question and for them to decide who they are, what their identity is, they're going to need to push away from their parents. And they're going to need to have good, strong connections with other adults than their parents. And also, they're going to really develop a lot of their identity through their peers. And so everything we can do to encourage that social connectedness and social relatedness is going to be extremely helpful for our teenagers as they continue to develop their sense of identity. Now, I've had the luxury of talking to many families, probably over 100 children and teenagers over this last month and a half, and I've been able to inquire about how these events have been affecting them. And the emotions are all over the spectrum, everything from sadness and frustration and anger because of the things that have been lost, whether it's a parent who's lost their job, or a teenager who has lost their ability to have a high school graduation that they've always dreamed of, or my teenage daughter who wasn't able to go to the school dance because it was canceled. And there's a lot of grieving for these things that our teenagers are losing. Also getting lots of emotions of anxiety, fear, and worries. And this is oftentimes remedied by helping children be able to express how they're feeling, being able to provide them with some healthy and positive ways of expressing that. But also letting them know that it's safe to talk about those worries. And again, as parents, being that source of truth where their children can come to us with questions, and we can be able to provide them with good information that really fits their developmental level and fits that child who we know so well. I think lastly, what I'd like to just mention is that obviously, although our teenagers aren't happy about this, one of the benefits we're noticing as parents of teenagers is we're around them much more than they would like us to be. And so with this increased supervision, we should be better at noticing if we're noticing any symptoms or signs of concern, whether our teenagers are becoming more isolated or more irritable and reactive. And if these symptoms that we're noticing or things that we're noticing, if they're worsening. One of the things I want to really make sure that our audience appreciates is that pediatricians, therapists, psychiatrists, these resources, our clinic is open. We are able to see our families and our children and our teenagers through video visits. We're also able to see them in clinic. So if you're concerned and feel like you need more help than what you have available within your family or your social network, please reach out to your pediatrician. They are a wonderful place to start. The other thing I wanted to mention is a program that we started through Intermountain Healthcare in coordination with the University of Utah and also our county mental health systems, as well as NAMI, is the Emotional Health Relief Hotline. And the number you see right now is on the screen. It's open from 10 a.m. to 10 p.m., 7 days a week. And this is a free resource for anyone who would like to call. And you will be able to talk with someone who has been trained in, first off, just being able to listen to what's going on, which can be so helpful, just having someone to listen to you in a very supportive way. But also they will be able to ask us a brief series of questions to try to help identify what level of resources might be most helpful to you. They could be anything from connecting you to some of the amazing community resources we have with some of our supporting partners such as NAMI, or it could also be giving that person a warm handoff to the Uni Crisis Line if there is some concern about suicide risk. And Congressman McAdams, as you mentioned, and I'm sure Taryn will also talk about, is one of the biggest concerns we all have is if any of us are having thoughts of suicide, that we feel that we can reach out for help. One myth that we must dispel is that asking about suicide increases your risk for suicide. That is absolutely not true. And if you have any concerns, inquiring and asking is really one of the best things you can do to protect that loved one. The other thing you can do that can be very helpful is if you're a family household who has access to firearms, it would be very important for you to secure those firearms, because one of the best ways that you can support yourself and your family to keep your family safe during a time like that would be to make sure that this individual would not have access to firearms, since that's the most successful and common way that someone dies by suicide. So those are just a few of the points that I wanted to make, and I'd be happy to participate in the question and answer at the end of this session.
That'd be great. Thank you. So thank you, Dr. Mickelson. I know as a parent, I made some mental notes to go and talk to my wife about how we can support our 4 young kids as well. So now we're going to hear from Taryn Hyatt. Taryn, want to go ahead?
All right, well, thank you so much. It really is an honor to be with you all today and just appreciate the conversations that we're having. As has been mentioned, you know, now more than ever is such a critical time where I think that mental health is being addressed more meaningfully than it ever has, because we are all experiencing a similar feeling. And so maybe if I've never experienced depression or anxiety before, and I am now, I'm more willing to talk about it, because that stark reminder of we are going through this together is amazing. So I did prepare a few slides, mostly to keep me on track. I don't know if any of you have experienced the brain fog. I definitely am. My brain is not working the way that it normally works, and my short-term memory is gone. I just wanted to share a couple thoughts that our team has put together just in regards to enhancing our mental health surrounding COVID. Foremost, just as Congressman McAdams, you know, alluded to, our mission with AFSP is to save lives and bring hope to those who've been affected by suicide. And we do that by really focusing on, so if you can go ahead and go to the next slide. Thank you. And the next one. I jumped ahead. You know, mental health is such an important aspect of our human health. And it's so interesting that there has been the stigma that has always surrounded, you know, our brain. Our brain is an organ like our heart, our lungs, and our liver. And if we were experiencing ailments in any one of those organs, we would readily seek treatment and help. And we need to get to that place with our mental health as well. And just like our physical health, where we practice, you know, proactive strategies to increase our you know, capacity to stay healthy by eating well and exercising, we can practice those same kind of strategies, you know, with our brain. And it's so important that we do that right now more than ever. Next slide. And also, you know, as we're going through these times, it's important to watch for the warning signs for when our mental health starts deteriorating. We know it's going to ebb and flow. That's a natural progression as we go through life and experiences. And when we start experiencing stressors, though, you know, we know that it could be a contributor to something more, but it's worth investigating if it's starting to affect my day-to-day life. And a quote I heard years ago that I love just mentions that, you know, when our brain gets sick, the way we know it's sick is it manifests in our behavior. It starts to change. You know, my sleeping patterns may change. I may be exhibiting behavior that I don't normally do. You know, I know for myself, these last few weeks and months now, you know, I'm quicker to anger because I'm just confined, and there's just things that I'm experiencing that definitely aren't my natural or my normal behavior patterns. And so being mindful of those. And since we all have good and bad days, you know, it's something to just be aware of. And if I start noticing some of these changes that are listed on the slide, you know, it's important for us to reach out and connect to somebody who can get us some help. And just like has been mentioned, especially if my brain starts having thoughts of suicide. we really need to again, get rid of that myth that Dr. Mickelson brought up, that by talking about it, it perpetuates. It doesn't. I'm somebody who survived multiple attempts as a teenager, and nobody was talking to me about it. And I just wanted desperately to be able to share what was really happening in my life. And if they asked me, I would have told you. And I would have been able to have a conversation that could have provided me some relief. So let's remember that. So let's take care of our mental and physical health. Being vigilant right now about getting a good night's sleep. Sleep is so restorative to our brains, and trying to implement basic hygiene. I don't know about any of you, but the first few kind of days and weeks of the, stay at home, I found myself acting like I did during the holidays, where I was staying up late and watching TV all night, and then, sleeping in late, and having to kind of get back into a normal pattern. Making sure that we're being vigilant about getting up and getting away from the screens. I'm working from home, so I'm on video conferencing all day. And even today, I got up after one event I had and had to just go take a walk, right? And just breathe some fresh air, stretch, dance, play some games. I definitely have busted out some card games that our family hasn't played together in years. And it's so important that we remember to take care of our physical and mental health. And I love this next reminder, staying focused, on what we can control. While yes, right now, everything feels so uncertain and up in the air, and I am a total control freak. I'm a planner. I want to know when things are going to happen and how to do. So this has absolutely been something I've had to kind of take a step back and go, okay, what do I have control over, and focus on those things, such as sticking to my daily routine, still getting up in the morning and showering, even though I'm working from home, doing those day-to-day tasks that I would normally. So it feels like I'm living in some sense of normalcy. Making sure that we limit our news intake. I watched the news consistently those first few weeks, and it got to a point where it wasn't healthy for me. And this includes news on social media. If it's making you feel more anxious than connected, turn it off. Maybe set yourself a time limit where I can spend this much time a day, engaging in that. This has definitely been a great time for us to be reminded of doing something we don't normally have time for. Maybe playing an instrument, journaling, meditating. There's some great apps out there that can help us. I love Headspace. That's one of my favorites. And just trying to make our environment safe. I love, again, what Dr. Mickelson shared. This is a great time for all of us to just take note. What's around us? What do people in my home have access to? If I do have medications, firearms, things like that, storing them safely. And just so we're safe and comfortable. I know I've even pulled out my blanket my mother made me years ago, and I've kind of been snuggling to that. So even having just a creature comfort is helpful. Next slide. And then lastly, just remembering that we need to stay connected. We've heard the term social distancing for weeks now, and it really means physical distancing. We still need to connect to one another, because that is one of the strongest ways we enhance our mental well-being, is being around humans and connecting with them. So reaching out, when you're feeling lonely, using technology or finding creative ways to connect with folks, group texts. My kids and I have been doing Snapchat streaks, and just ways that we can stay connected and talk about something other than the state of the world today, and trying to just feel a part of. I'd encourage you to check in on your older neighbors, leave notes for them, run errands for them if it's safe for you to do so, and just find ways that we can still stay connected in this time where everything feels so disconnected. Next slide. And it's been mentioned that we need to work on supporting our children and youth, and just a few thoughts I had here, that I've seen with my nieces and nephews. I have older children, so they're not home with me. My heart goes out to all you parents being teachers. I don't know that I could have that added to my plate right now, so I'm giving you virtual double high fives. But listening to our kids, reassuring them, making sure we're limiting kind of the conversations they're hearing, making sure that they don't necessarily have to hear all of the COVID-19 overload, providing that extra reassurance and finding activities and ways that they can connect to their friends, virtually. Never in my life did I think I'd be encouraging my 12-year-old stepson to use this technology. can feel connected. And I think that's vital and important. So just making sure that they feel safe. And then this last slide is just some resources that have been spoken of. You know, we do still have access to things like our primary care doc. We can do teleservices if we don't want to go in person. So many clinicians are offering telemental health services. So while yes, we may have some things going on and not want to be out, resources are there, they are available. I'm so grateful for the emotional distress line that IHC created. The SafeUT app has been a tremendous support for folks. But if you maybe have never seen, you know, a mental health professional or and kind of wondering if maybe is a right time for you, I encourage you to seek out a few names, have them ready and available for if and when you do need to make that assessment and see if more help is needed for you. But, you know, we are just all in this together. I just can't say that enough. When I find myself feeling frazzled and I'll share with somebody, oh my gosh, my brain today, and they go, me too. You know, we're going to get through this together. We need each other now more than ever. Thank you, Congressman McAdams, for providing this opportunity. And I'm so grateful for the partners that are on this call as well. Rob, Nami, you know how much I value and appreciate the work you do. So just thank you for this opportunity to be part of the conversation today.
Thank you, Taryn, and thanks for those tips for everything from small. And, you know, I heard somebody else told me to give yourself permission to not consume news 10 hours a day. You can get everything you need in an hour or less sometimes, and give yourself permission not to do that. But also some of these other resources here that if you need them are, please don't hesitate to reach out, and some free resources and available to all of us. So those are great tips. So lastly, we will hear from Rob Wesseman. Rob, do you want to go ahead and then we'll get to questions?
Yeah, we've heard some great stuff. I mean, I'm just going to add a little bit. And thank you, Congressman, for putting this together. It's really important that we maintain focus on mental health. We don't really know what's going to happen. I mean, we're in this kind of beginning stage of how things have changed dramatically, and we want to be ready as we move forward. We want to have resources in place. We want to have people feeling comfortable to reach out. Taryn mentioned the teletherapy that's happening now. All of those things are super important. So I'm just going to add a couple of things. NAMI also does a support telephone line, and we get 20 to 30 calls a day. And this is a little bit of compilation of what we're hearing from people with mental illness as well as their families around what's happening right now. And also some resources from NAMI, our national office. And one of the things we talk about, you know, news overload and information overload. One of the things we want to encourage people to do is seek out certain resources. And by that, I mean things like CDC, the National Institutes of Health, SAMHSA. These folks have great, unbiased, you know, scientifically based information that can really help add to that focus. And then we would also encourage limit the time. I mean, as this began, I remember reading a story about, do you really need to know what's happening to people on a cruise ship 1,000 miles away from you? Probably not. So, you know, we have to be careful about that intake and get the right information. We also mentioned a little bit those routines, and Taryn, it was funny that you mentioned, you know, oh, I'm on vacation. I had a bunch of staff doing that. I did it a little bit, but, you know, as Dr. Mickelson mentioned, we need routines and we need, you know, things to count on and that. And so, you know, get up and make your bed, even if you never have before. That's something you can start doing. You know, get dressed, take breaks throughout the day. Taryn, you mentioned that you took a walk after a meeting. Yeah, it's amazing. You can stack meetings right next to each other now. And so we're almost busier than we were before. So, you know, we really want to watch that. And then we talked about some symptoms. If our sleep is really disrupted, we need to attend to that. If we're really overly focused on this negative news, or if we just aren't interested in doing anything. I mean, those are things that both we recognize within ourselves, as well as we may see in other folks. And Dr. Mickelson mentioned too, we can reach out to people and say, gosh, it seems like, tell me what's going on. Because one of the other things we hear a lot from the folks that call us is they just need someone to listen right now. Just, hey, what's going on? We don't need to fix it necessarily for them. We just need to talk and experience what's going on with each of us right now. So I think just really listening to the people around us can be incredibly helpful, especially for young people. They need to talk through some of what's happening now. And so I think we can do a good job at doing that. I want to mention just a couple of things specifically. On the NAMI national website, there are some great resources in terms of warm lines, support lines. Some of the apps that Taryn mentioned are listed there. So if folks are wondering, where do I go to start? There are resources like that that are available. So we just want to make sure that people know about those things. You know, the other thing, and it was mentioned before, is, yeah, the term social distancing, completely incorrect. And, you know, to reach out, I've been trying to get my mom to do Zoom meetings for like 2 months now, but it works. I mean, you can actually get connected. And once people get over this goofy, oh, why am I staring at a screen? I think it works okay, especially right now. I see some of my family more than I did before. So just saying that we can use these new resources and help people get, you know, a little more comfortable with those. And now what we're seeing is, you know, online support groups, online education and mental health education and those kinds of things. So, you know, we see on the screen here, NAMI is now doing online support groups for both families and people with mental health conditions themselves. And it's actually really cool. We have people from Cedar City, Box Elder County, Tooele, and Salt Lake all in these meetings. It's really cool. So there's some things we can do, but I think one of the things we have to remember is let's listen to folks, and let's you know, let's listen to folks, and we you know, we don't always need to necessarily solve right in the moment. Let's listen and talk and get people connected to the things they need. So I think I'm going to stop there because I'm really interested in getting to the questions.
Great. Well, thank you, Rob. Very helpful information as well. And NAMI is such an incredible organization. So I want to remind our audience today that, that we are recording this webinar, and we will make this event available to the public so that you can share these presentations and this helpful information. If you, as I am, listening to this and thinking, oh, it would be really helpful, you know, I'd love my wife to hear some of this stuff so we can talk about it. So if you're having a similar thought, this will be available. You can share it with others, anyone who you know for whom these resources might be helpful. So let's start by taking questions from the audience. And please remember that the topic of this webinar is mental health and wellness. So if you have a question on another topic, you can go ahead and submit it to the moderator, and we will make sure to follow up with you after the webinar. So our first two questions are from participants that were pre-submitted. They pre-submitted a question when they registered. So let me just ask the first one and invite our panelists to respond. How or what is the best way to help children cope with stress under the current circumstances?
Would you like me to take that one?
That sounds great, Dr. Mickelson.
Okay. A bit of, like I mentioned earlier, I think a couple of the strategies that seem to work best when we're helping our children is maintain a routine, make sure that they're sleeping and eating well, make sure they're getting tons of time to play, outdoors if possible, make them feel safe in talking about how they're feeling, respond by reflecting back, here's what I'm hearing you say, and allow them to maybe even try and solve problems themselves, at least make them feel that they are playing a big role in that problem-solving process. And if those concerns worsen, reach out for help. And I would say the pediatrician is, again, a great place to start if you're a parent and you have a concern about your child.
Thank you. I think I am failing on about half of those, so I will get to work. And routine is certainly playtime we're succeeding at. Routine, not so much. So we'll get to work. Anyone else? Okay, so I'm going to move to the next question. Thank you. That's very helpful and something to work on. I think we'll all be failing to some degree, and but this is helpful to know some of the things that we can do. Christina in West Valley City asked, she said, I'm a high-risk individual and have been strictly quarantining. I miss my grandson and I miss my family members. How do I overcome this feeling of, quote, this is how my life's going to be from now on? I don't know if any of the panelists, Rob, you kind of talked about that a little bit with your mom. I don't know if any want to add anything with that.
Yeah, I'll just jump in a little bit. So one of the things we've done with folks that we've been talking to is creatively problem solved. I think we mentioned earlier that this really has changed how we do almost everything right now, and certainly interacting with family is a big part of that. And so what we've had to do is be somewhat creative. I mean, getting on the phone isn't super creative, but encouraging people to do that more regularly has been a challenge for some folks. Getting folks to attempt to get on a video chat kind of thing, FaceTime on an iPhone, that can be pretty problematic for some folks. But I think the challenge becomes getting in that mindset of learning some new skills and techniques in which to reach out. I think the other piece is to establish some kind of routine with that as well. I mean, that's one of the things maybe we took for granted before. Oh, I can go and see my family anytime I want to. Now that we can't, we've talked to a bunch of folks who set kind of scheduled times throughout the week where they reach out to family. So some of those pieces, we have to be deliberate about the change, but we can integrate some good, successful strategies.
Taryn,
I'll just add
Yeah.
something. I even saw, one of the news things I do like to watch in the morning is the Today Show, because they highlight creative ways that people are staying connected. And, I have a neighbor that lives just down from me, and, her mom is not able to be in close contact. Obviously, she's high risk. My mother is as well. And so we've had to find creative ways for them still to see their grandkids, even if it's talking through the window and the screen. But I watched this one family, they actually created a hug shield. And it literally is a wall of plastic sheeting that had arms that are plastic coated, that this mother could actually put her arms in this plastic thing and hug her little grandbabies. But I thought, what a creative thought. So I know right now it's not what we're used to. And I agree with Rob. It's just trying to find creative ways that we can still feel connected, feel a part of.
That's great. Okay, so the next question is from Miriam. She says, as a single older woman with no family, I spend most of my time in front of the TV. How do I get motivated to get off my bed or my couch? I have some friends, but I haven't seen them in 2 months. I only see my bishop's wife once a week when she gets my groceries. And I also don't have a car, so I'm very isolated. Thoughts on that? I think that describes all of us to some degree of just feeling isolated, that isolation. But and
I could maybe yeah. I'll give a few thoughts on that. I think, Miriam, that's a good question, and whether you're your age or you're a young child or a teenager, we all know what it feels like to want to do something we're not doing right now. I'll tell you that don't punish yourself for not doing it, because punishment doesn't really work very well. Find ways that you can maybe reward yourself for spending a few minutes outside. Start small, because even when you're a little baby, you don't just start running right off. You take little baby steps. And like has been mentioned, like Rob mentioned, maybe schedule something into your day. Once you find that you're good at something and you're getting better, like maybe feeling like you're in a little bit better shape, and you develop this new routine, it'll be easier for you to get out of bed, get off the couch, get away from the TV. Maybe the other thing I would recommend you to think about is what brings you a sense of purpose, what brings your life real meaning. And regardless of how old you are, you're wired to be altruistic and to be helpful towards others. and what are some things that you can do that would help you become more active, but also give you that added feeling, that feel-good feeling of just doing something positively for others. Few ideas that I have.
Great suggestions. Anyone else?
I would just echo the part about self-forgiveness. We can be so hard on ourselves, you know, and I've really had to practice that these last few weeks, because some days I just feel like I'm chasing my tail. I don't have the motivation to sit down and do the things I need to. So, you know, if I make a list of one thing that I'm going to make sure I accomplish today, and like he said, when I get done with that task, celebrate, you know, and be I was able to accomplish that. So little milestones. And, you know, again, I have been amazed at the amount of support groups that have moved to some kind of a virtual format. I'm also a person who lives in recovery from substance use disorder, and I have missed my people. I have missed my meetings, and to be able to still join them through Zoom. And even though we are not together, to see their faces, to be able to share again openly where I'm at. I love that NAMI is providing the different groups that they are too. So there are things out there, and we can help connect you to some, but you know, even just maybe taking that step and joining a support group and, you know, finding some other people who might be sharing some of your similar feelings.
Thank you. Yeah. Okay, the next question, how do young people get help? My daughter's friend is between schools, graduated from high school, not yet in college. Does the Safe Utah app work for non-students? The answer is yes. Yes, most definitely. Are there other resources for non-enrolled youth if they're not in a formal school program?
Well, if I could just answer that question based on what we have available through our emotional health relief hotline. I think if this young adult would like to call this phone number, they would be able to find out a little bit in more detail what is this young person's needs. And what we've noticed is that about 50% of the people who are calling this hotline are able to get some support and resources by apps and tools and groups that are available within the community for free.
Uh-oh, we froze. I think Dr. Mickelson. Is it just me, or is he frozen?
Yeah, he's frozen.
Okay, Rob, why don't you pick up? I don't know if you have some resources, and yeah.
Yeah, so what I've been thinking about as we've been talking is
while she's in between.
Oh, there we go. We lost you, Dr. Mickelson. We lost you for a minute. So.
Oh, sorry about that. I'm not sure where you lost me. Am I back?
You're back.
You're back.
You're good. Yeah.
Oh, this Zoom, isn't it great?
I know we lost you for about 15 seconds. So.
Well, so maybe just in summary, I would ask this young adult to reach out to a service like our emotional health relief hotline, because that could connect this person to someone who could help them navigate and identify for themselves what is the best thing for me to do next. Because like Tara mentioned, it could be something like exploring an app like Headspace and doing some mindfulness meditation. Or it could be something a little bit more like establishing with a therapist and having a few visits with a therapist before you go off to college next fall.
Yeah, thank you. Let me give this next question to you, Rob, also.
Okay.
So this question comes from Mary Beth, and she asks, how can I best support a family member who is struggling with a relapse due to feeling completely overwhelmed with the anxiety at times?
You know, we just talked about how badly we punish ourselves when we have, you know, a relapse, a mistake, negative feelings, etc. And this kind of ties into the continued proliferation of stigma. And really what we can do when someone is having those struggles is simply listen, validate, and look for those little successes. Because believe it or not, even when someone feels like they're not doing anything right, there's something right in there. They're still with us. They're reaching out. They're talking to us. We used to work with young people who were struggling significantly, and we always took it as a great success when they would tell us to go do terrible things to ourselves, because they were at least interacting with us. And so what we're looking for is, hey, we're talking. That's great. That in and of itself is a success. And I was going to mention earlier too, I would always encourage people to take a look at whatever worked before COVID-19 and all this kind of stuff. We had some structures in place. Reinvigorate those or reestablish those in whatever the new now is kind of thing. Because they're there. Like if somebody is in front of you, that's a success, and the successes are there.
Thank you. I want to just make a comment. I see somebody in the chat, Janet, mentioning there are a lot of online resources, not just mental health resources, but exercise classes. You know, we have my son is taking piano lessons by Zoom, you know, so, and that's a one-on-one type thing, but there are a lot of just other resources out there. I think as human beings, we need that connection in some way or another. So my wife does an exercise class that is online that she used to go to in person. She does. So there are not only mental health resources, but so many other resources available online. So thank you for that. The next question we have comes from someone who wants to remain anonymous, and they say, we know that there are significant mental health issues that are being exacerbated by COVID-19. How do you feel that the CARE dollars might be used to provide trauma-informed responses to these folks? Well, let me just answer the first part, since it's kind of a policy question. So the CARES dollars, they're referring to the CARES Act that Congress passed, bipartisan, signed by the president just over a month ago. The CARES Act provided further support for substance use and mental health services administration programs to reach those people who are in crisis. So specifically, it included funding for suicide prevention programs, and a previous bipartisan bill called the Families First Coronavirus Response Act also provided further support to Utah's health programs to support behavioral and mental health care, and facilitating some of what we've seen is this move to telehealth and telemental health. So let me pose the question to our panelists here, Taryn, Travis, or Rob. Do you have anything that you want to add about these resources, or maybe something to me that Congress needs to tackle? What can we do to further support your delivery of these resources?
Well, I think for us, you know, in the area that I've been in for years, this is just a prime opportunity for us to really elevate the conversation about mental health. You know, again, we are seeing barriers be broken down because so many of us are experiencing it. So just now is not the time to let off the gas. You know, we have made some great strides nationwide, but especially here in Utah. We need to make sure that we continue the funding for things like our mobile crisis teams. And again, folks, remember that we have access to a peer support system in our state. You know, there are so many through NAMI. There are so many great resources, as Rob mentioned, that were already in existence. We just need to continue to use them and make sure people are aware of them. You know, we've moved all of our educational events to online. You can visit our website at afsp.org. /Utah, and we're hosting trainings online. Join us, you know, join and be part of a conversation, be part of a group of people for 50 minutes, you know, just to feel connected. But we just want to keep the focus. You know, this is the time that we really make sure that, yes, we take care of the people who have been affected and the trauma that a lot of folks are experiencing. They are going to need us now more than ever, and we're in this together.
Thank you, Taryn. Okay, so next question comes from Melody. Dr. Mickelson mentioned that it's helpful to give kids ways to express their emotions, and I would add also to be bought in some of the family decision making. So do any of you have suggestions for activities to help kids with this?
You know, I think this is Melody. So Melody, one thing I want you to think about first is just based on the age of your child. What is your child interested in terms of, is she interested in reading? Is she more into art? Is she someone who really likes being outdoors? And you want to try and connect these activities that she's good at into ways of helping her maybe learn stories. So one example would be if your daughter loves to read, go to your local bookstore or to that other place, starts with an A, I can't remember. And there are lots of books out there for children where the main character is someone who's also struggling with big worries or is dealing with a big loss in the family. If this is a child who likes to be outside and ride bikes, and this is maybe someone who's 11 or 12 years old, go on a bike ride with them, and maybe you open up that conversation. I think the thing is try several approaches and you'll know which one works best. But the other thing I want to remind you and all of us parents is that we have a great opportunity to be role models and to set an example. And one of the best ways to make a child or a teenager feel that it's safe to talk about these big feelings that they're having is to see that their parents can talk about the big feelings that they're having. And for me as a parent to be able to express to my children that I'm irritable, for me to be able to say, I'm irritable, I'm gonna go take a dog for a little walk, or I'm just gonna sit down and take a few deep breaths. Or yesterday when I caught myself being a little bit grumpy with my teenager and kind of overreacted, I could go back later and apologize and make sure that he knows that I'm sorry for how I talked with him. So there's a lot of things that we can do as parents to really set the stage and be role models for how we'd like our children to manage their big feelings. Because after all, we're the ones that are going to be teaching them how to do this.
Anyone else want to add anything there?
Just a big ditto.
Yeah,
Yeah.
that's good.
Behavior.
Well, thank you. So I think we've reached the end of the hour. So let me just pause there and let me thank those who joined us today. Thank you for spending the time with us. Thank you to our community experts as we discuss ways that we can improve and protect our mental health during this pandemic. As I mentioned, we all have a state of our mental health, and it is something we should always be aware of and be working on to make sure that we are mentally healthy, just like we should take care to advance our physical health. And so I've enjoyed this conversation, not only I think to record this and put it out to the community, but on a personal level, I have to say it's something that I think every parent, every individual is thinking about as we are really struggling to cope in some unprecedented times. And I know this can be a heavy topic for many of us, and I hope we've touched on some of the resources that are available, and also let people know that if you are, if the state of your mental health is troubled right now, that you're not alone, that others are also feeling that. Let me also just say again, if you or someone you know is in crisis or thinking about suicide or simply could use some help by talking to somebody, please use the references that were please use the resources that were referenced earlier in this conversation. And also, if you're have thoughts about suicide, please call the National Suicide Prevention Lifeline at 1-800-273-8255. I'm going to repeat that. It's 1-800-273-8255, or text the crisis text line. You can just text 741-741.